Good morning, Cynthia. Good morning, Patty. Good morning, Beth. Hello, everyone.
Oh,
Okay, I can hear you, so I'm assuming somebody can hear me on that end.
I can hear you. This is Beth. Hi.
How are you?
Good. How are you?
Good. You know how you start a video and you got it all lined up and then you turn your camera on and it's not really lined up? Give me 2 seconds. I want you to be able to see all my goodies. There we go. So how's our Saturday? Thank you for joining me on the weekend, you guys. There. I see Angela, Sarah, Patty, and Cynthia. And for anybody that can't join for the entire session today or are watching this later, it will be recorded, and all of my videos are always in the media files. So if it's a product info thing or it's a how to do thing, there's a whole media library with things to keep you listening to my ramblings for hours on end. So thanks for those of you that have joined us. Today is the first of a few sessions that I'm going to start doing. Many of you have conditions, many of you have multiple conditions. And a lot of times, one treatment is never the answer to every symptom that you're dealing with. So primarily my love and my life is the vibration plates, but there's so many things that combine well with them. And some of you are doing those types of things already. I have an extensive history in a studio long before I got to where I am today. And I got into light therapy probably about 12 years ago. And it's kind of a funny story how I fell into it. In those days, the market's kind of gone through a cycle. So, a decade or so ago when the non-invasive they were more marketed as the fat treatments. And if you remember way back to the eye centers, when the eye centers were giving laser and so forth, well, more and more studies are always in the works when it comes to light and laser. And I'm going to go over some of the differences between those today. But at that time, I had all these studios calling me, and the eye centers had started offering pain and fat treatments using their same laser devices, because there is a lot of different scope of benefits that you can get from using red light. But one of the big things that I want to stress a couple times throughout this chat today is if you are using light therapy, anything non-invasive to liquefy or break up the fat as they market it, there is typically a requirement for a post-exercise thing. So if you're using any type of non-invasive lipo treatments, there's a bazillion out there. There's ultrasound, there's light, there's all kinds of different ones. You should be using something after the fact, going for a walk, going for a treadmill, using a vibration plate. And then what happened about 10 years ago with my studio is I did get a lot of calls from other studios that happened to be incorporating these red light devices. And, nobody really wanted to do a treadmill or run a class afterwards. A lot of these places were spas, these serene environments, and the vibration plates were becoming very, very, very popular. So fast forward a few months, I started looking into my own devices. If I'm going to be incorporating and recommending post-treatment protocols or pre-treatment protocols using the machine, I wanted to have a better understanding of what these devices were actually capable of. And I always had a big suite of willing clients to try things out. So I actually got involved with a manufacturer out of the UK, a commercial paddle system. It was called Lipo Light at the time. They're still a company. I was their Canadian supplier for the better part of 3-4 years. And for the bigger parent company, the medical company in England, it used to actually be called Physiolite. So in North America, a lot of the red lights being used because of regulation and the way that they're brought in, they're brought in kind of in the aesthetics market as an aesthetics treatment, but there's a lot of evidence and there's a lot of reason you'd want to use them for medical benefits as well. So, there's not different types of lights to address different benefits. But I will get into some of the added bonuses or the benefits that you may be experiencing if you're using some of these products. So fast forward 10 years, the consumer market, like it always has in the last probably decade and a half since the eBays and the Amazons have come to fruition. We've seen this shift of commercial devices, and they're still out there. You walk into a laser doctor office that's using a medical grade laser, and you could be looking at $250,000 investment on something like that. The LED devices, some of the ultrasonics, the cavitation, 10 to 30 to 50 to 100,000, they're commercial grade equipment. They're meant to take abuse all day long. The light on the light, there's a difference between commercial and home equipment. What I'm going to be talking about today, and what many of you are probably using at home, are consumer or home grade light technologies, just like vibration plates. So there's commercial grade, and there are some different performance levels, but in a home environment, you can benefit in a lot of ways by incorporating this into your routine. And I think the biggest win for my community here in the group and the general population is if you have it at home, you're more likely to do a treatment more often. Back in the day with mine, it was, when I was about a third of the price, I would be $350, $400 for a 10 treatment session. Most of you could obtain a belt or a mask or something within that budget for your own home use at this point. Hey, Kim. So I'm going to go over 3 examples. Lifepro has been kind enough to give to me 3 units to go over with you today. I've been using some of them more than others. And my preferences and what I'm using them for may resonate with you, and maybe you've got your own ideas or other ways that you're using it now. So I'm going to go over a little bit of information. Then I'm going to get into each of the products, and then I want to leave a healthy amount of time at the end to allow you guys to ask me any questions. I am not claiming to be a red light expert, but I have done a substantial amount of research. I've got tons of hours of application experience with a lot of different clients. But what's so funny is I did all of this before I even knew what lipedema was or Derkham's disease. And so there's light bulbs going off all the time. And as I dig into the research with these types of conditions, I'm coming across more and more applications for these types of devices in combination with the plate. So why is it Vibe plus light for therapy before I get into the notes? As I said, if you're using this in particular for toning, weight loss, inch effects, you want to make sure there's an exercise component there. Weight loss is never one thing. Toning is never one thing. The food piece needs to be there. There's some wonderful ladies in this group that have way better pages talking about that. I recommend checking out Cheryl's page, her and Angelique, and oh my God, Kelly. Are a wealth of information when it comes to that piece. And even though it's something we should all be talking about, I try to keep most things on this page related to how the Vibe helps you with blah, blah, or blah. So if you're using red light, how would you incorporate your vibration plate? To start, really however you would want to. I personally feel, based on some of the research specific to the subcutaneous fat, the lipomas, things you might be dealing with, there is merit to using a machine prior. Doesn't need to be a whole workout, but if you're the type of person that is doing a bigger routine, or you've got a routine in place with your machine, I would recommend using this after. And I would also recommend doing a few minutes on the machine after you've done the light treatment. Keep in mind, the main reason we want to be using the machines is to get that lymph and that circulation going. If you as an individual are the type of person that has a little bit more discipline, you want to do some working out, that's entirely up to you. All I'm suggesting, the bare minimum, if you're incorporating vibration with red light or other treatments in complement, use it for a 2 to 3 minute period just to get things warmed up. You're going to be likely sitting down for a period of time, so it'll get you loose. And then after the fact, you want to help just keep things moving, help that system be more optimal. And if you have been sitting for a period of time and you're numb and you're sore, do whatever you would normally do to treat those types of issues. If you've got low back issues, if you want to do some squats, whatever you want to do, the goal is to get 2 to 3 minutes post-treatment to expedite what the treatment has done for you. If weight loss is the goal, I'd prefer that 2 to 3 minutes, maybe include some squats or something that's going to boost the metabolism, get the calories going. Okay, so let's get into a little bit of the science. I was digging around on the internet last night, And you guys are probably versed with many of the sites as well as I am, but I was coming across some additional information on some of the lipedema websites. And two things that we're talking about today. First off, vibration. Most of you know that vibration is recommended not only by FDRS, but the majority of doctors in this community. Are they vibration machine experts? No. So if you are getting a recommendation on what to set your machine at, how long you should use it for, even within this community, as much respect as I have for all the doctors in this community, you're using it in complement to other treatments. So as far as hurts or how long, I would prefer that you direct those questions to me, because it is more based on what you personally are doing. And there are no blanket, there's no perfect frequency, there's no perfect time to treat any one condition. Just, if there's one treatment that worked perfect for all of you, we wouldn't need to be meeting with Debbie on a Saturday. So vibration, this has been shown to stimulate vascular and lymphatic circulation. It reduces pain, reduces inflammation in people with lymphedema. Okay, that's where a lot of the literature is, but we know there's a side bonus for you guys. It can also be useful for those with lipedema, and I want to add Derkham's disease, and all the other made lungs. There's more than just one or two conditions. And with proper training, it can be a good addition to your home program. Handheld vibrators have historically been used clinically to remodel many different types of hardened scar tissue. Whole body vibration has been found as an effective treatment for lymphedema and lipedema. So it talks a little bit about the vibration machines and the guns. The vibration machines are going to be more of a total body. They're a weight-bearing exercise. You're going to get more exercise benefits, even if you're just basically standing on it. The gun is more of a targeted treatment. So maybe before we get into the red lights, maybe there's a particular area that you want to treat. Maybe you've got some lumps and bumps in the hips, or you've got a lipoma that you're trying to target. You could use the gun to warm up that localized area as well before you do your treatment. The whole premise of vibration is to get that lymph going, that circulation moving, maybe warm up the tissue in the area that you're going to treat before. Something else I want to bring attention to, and they've laid reference to low-level laser. So low-level laser, the anti-inflammatory and anti-fibrotic effects of near-infrared non-thermal light therapy is useful prior to and along with manual and instrument techniques. So if you're going for manual treatments, maybe some manual massage, or you're doing massage guns, the laser can be used as an anti-fibrotic instrument while delivering light therapy. So even within this term off a very prestigious lipedema site, there's been two terms I just want to hone in on, because this is where it gets really hard for you guys on the internet when you're looking at these things. We have the category listed as low-level laser, yet we have an instrument that delivers light therapy. Two terms already introduced, and there's about 50,000 more once you look into it. A lot of the treatments out there in the LED world started as lasers. So years and years and years ago, before LED lights existed, lasers existed, and a lot of the early treatments were laser. Laser is very different than LED. It is much, much more costly. If it is a true medical laser, you're not going to be buying one off eBay for your home use. You need to be certified, at least in Canada. There are some regulations in the States, but I couldn't even go buy one and put one in my shop if I wanted. I do not have the training or the licensing to have that type of a device. And to my experience, there's a little more risk if I had to pick a laser over a light. I'm always about bang for your buck. So most of the stuff I focus on is about making it accessible, affordable, something you guys can work with it in your budget and within the space you're working at home. Lasers wouldn't fit that bill anyways. But a lot of the studies, and I must have looked at 150 studies last night, even the researchers talk level light, like they're mixing up the terminology. So what I have noticed, and there's a couple of studies that I've come across where the benefits between laser and LED in many cases are the same. Okay. So a lot of benefits you might be reading about are more about light therapy, laser therapy. They're kind of jumped into one big bucket. I will say some of the early lasers, and you'll notice someone asked me yesterday about pulsing lights. Pulsing lights are not only applicable in body treatments, but there's also a lot of neurological applications to pulsing lights. And somehow there's this mentality out there that if you're exposing yourself to to flashing lights, you're going to bring on a seizure, or those of you that have epilepsy are advised not to expose yourself to flashing light technology. It's kind of a gray area. Why would you want to use pulsing light technology? Pulsing light technology stemmed actually with lasers. The lasers run at a much higher operating temperature than LEDs. And if you were doing a treatment for a period of time, what would happen is it could become uncomfortable, or in some cases, there were even surface burn lesions on patients. So the pulse, when they initially introduced the pulse or were doing studies on it, was to simply give the skin a chance to not be under that constant present penetration of the heat. So there's a pulsing effect, and there are pulsing lights in neurological, psychological treatments, specifically stuff to epilepsy. If you have a known condition that is triggered by flashing pulsation or pulsation lights or flashing lights, don't look at it. A lot of this is common sense stuff. So if you've got a device that is pulsing, because there are benefits, and I will get into why, if you've got a flashing waist belt, don't put it on your face. And if you are going to put it on your face, don't use it in pulsing mode. So much of this is, I feel like sometimes when people come to the page, it's like they're trying to, hang me up or catch me sometimes. You can't use this if you have epilepsy. Actually, you can, but common sense needs to apply. If you have a diagnosed condition that says, do not look at a pulsing light, do not use red light, ask more questions, or until you know more, don't trigger your condition. So it's a very rare thing, but if you start looking on the internet and you start Googling pulsing lights, there's some pretty scary stuff that comes up. And when you get into pulsing lights in the neurological world, there are treatments that are specific to pulsing lights, but they're different. They're these devices that sit on your head and they pulse through the surface of your skin. It's not exposed to your eyes. Pulsing red light is a different benefit, and I'll get into that when we get to the benefits, but I just wanted to touch on that. Red light, what are the contraindications? Maybe we'll talk about that a bit now. If you do have epilepsy or something where you're triggered by light therapies, use your caution. If you have questions, ask me or the person that you're looking at buying the device off of. Ask them questions. A lot of times we don't go back to the manufacturer. We always go to Facebook, social media, and everyone on there always has the answers. And really, we want to hear people's experiences, but often experience turns into expectations that maybe the people you're talking with just aren't prepared to answer, or simply don't have the information. So if you want to ask, if you have questions specific about a device, check with the manufacturer. I got a call, and if you're on, I don't think she's here with us today, but I did have a customer day before last that sent me a link to a product on eBay. And I mean, this thing was crazy. It had ultrasonic, it had red light, it had panels, it had like a lot going on for $550. And I didn't get it. So I wanted to see what the light spectrums were. I wanted to dig it apart and do my diligence. And I couldn't find anything on this product. I couldn't find a brochure. I couldn't find a company outside of Amazon to go to. So sometimes the products being sold mass market, because this is a trend right now. Let's say Cynthia wanted to start distributing red lights. She could contact a manufacturer in China and she could say, this is what I want. And I want it to do these things. And as long as you've got the cash to put out for a container of those things, you could bring in the Cynthia light and start marketing it when you get back here. It's not that simple. You got to have marketing and things like that. But there's very few manufacturers out there that are innovating. And so when you're looking at something like a red light or electrolysis or anything that's going to have a health effect on your body, I would want to know who the manufacturer is, because if, God forbid, you have an issue, or if something just breaks or something goes wrong with your device, who is there after the sale, right? So I always think about that. And there's a reason I promote a particular company for that reason. I work with a lot of different companies, but for my consumer grade stuff, you can't beat certain companies that do volume, and they happen to have warranties that are a big benefit to me. So I just want to get back to a bit more of the science. Another term that you're going to hear about this is phototherapy. Phototherapy, there's all kinds of cancer treatments that have been explored with these. Some of them are in conjunction with pharmaceuticals, where you're applying a topical pharmaceutical on the skin and they're penetrating it with light. That's a common treatment for pre-skin cancer. But I'm also reading, there's a, why not just as a preventative piece? So there's health effects, there's fat effects, and we're going to talk about both now. So I'll get into a bit more science here in a bit. If anyone is particularly interested in something that they've read or a claim that I'm making today, please ask questions. Again, looking at the internet, you're going to get just as much good information as bad, even in the research world. So if there's something specific that you're looking for personally or something you'd like to take to your care provider to start a conversation, let me know what you're using it for, because that sometimes will give me a bit of a clue as to what type of product. One product's not going to treat everything. So let's get into the products a bit now. I'm going to start with the first product, which is a VisiCure mask. These are all Lifepro products, and you're probably going to see similar products, different labels available on the internet, but the promise of how they work are going to be very similar. So the first thing is it comes in a box. This one is an acrylic face shield, and I have children and dogs. So it is, I don't want to say delicate, but I like using the box for storage. So in the box, it comes with your manual, which is pretty self-explanatory. This is the mask itself. You've probably seen similar ones on the internet. It's just a pair of sunglasses. I have the most hideous, I'm gonna see if I can find my mask here. No, I don't have it. Oh, I don't have my example here. So like 15 years ago, when I got into this, the first light face mask that I received from this other company, it looked like a goalie mask, and there was battery. The thing weighed about 6 pounds. There was all this infrastructure. I had to wear glasses underneath it. It was very cumbersome, and it cost me $2,000 US. So innovation and consumer feedback. One of the reasons that Lifepro's products are so comfortable is they do get a lot of feedback from you guys. So that was really hard. I've already put it on my face. It comes with a USB charge. There's a little battery in here, and there's 3 different light colors. So on the side, you can push the little button. Oh, isn't that pretty? You do not need to wear sunglasses with this. This is not as intense. We are dealing with the face. I'm hoping that it's not blocking me completely. But as we are dealing with the face, it's not going to be intense as some of the wearables I'm going to get into next. It's got 3 different settings. So we've got a red, we've got a blue, and we've got an amber. Okay. Should have had this at Halloween. So what is the differences? And notice that I can look at a piece of paper or watch television while I'm doing this. You could even wear it while you're working at your computer. The number one thing I love about this is I don't have a long attention span. That's probably why I've stuck with the machines as long as I have. And I like to do things while I'm doing other things. So this is great. Maybe I'm working on a blog article or I'm doing something. You can see that there is no lights directly in front of the eyepiece. Okay. I'm always doing this. Take a drink of my coffee. Oh, my hair got caught in it, but it's very comfortable. You would wear this for about, the preset time on it is 30 minutes. If you have issues with the skin on your face, maybe you're dealing with a dermatologist, if you are taking medications that make you more photosensitive, there's a lot of them, look it up. These are all things that you need to consider before doing red light therapy in general. But particular to the mask, there's 3 different light spectrums. The red, the amber, and the blue have different wavelengths. And the red and the blue are more synonymous with acne, superficial, if you get blemishes. The red more prominently is going to be for anti-aging, the fine lines, rosacea, if you're dealing with sunspots, those type of things. Red light, I've also found in research to claim benefit to pre-cancerous cell treatment, or it slows down the development of those type of conditions. So if you're prone to melanoma and you've had confirmation of that in the past, or skin cancer of any kind, I do see a lot of clinics using red light therapy as a preventative piece. So that's just an interesting point. The red light is 620 to 750 nanohms. It's kind of the highest setting on the mask. The next step down is the amber. The amber runs at 590 to 620 nanohms. And the blue is $476 to $495. The blue, think like the color, it's cooler, it's not as intense. Great for the kids, teenagers using acne. There's different benefits. You know, if you're looking for more of a cooling effect, there tends to be more benefits associated with the blue light. Make sure that if you are using this product, get rid of any face jewelry. If you got nose rings or lip rings, and don't have your makeup on, it kind of defeats the purpose. Just have a good clean face and put on whatever regular face lotion that you would normally wear. I've had a couple people ask if it's okay to use self tanners. You know, if you use that kind of thing, that's fine, but this isn't a tanning bed. Self tanners, immediate self tanners, they're blocking your pores to a degree because they're depositing something that makes you look darker. So if you're specifically looking at doing a treatment, try and just have a clean face and have your pores, you know, as clean and open as possible. That would be my recommendation on that. The working time is going to run about 30 to 60 minutes per charge, depending on the settings that you're doing. And then the charge time on the USB is about an hour. I find 45 minutes to an hour by the time it's fully charged. So, and then when you're done with it, you can clean it with just gentle soap and a cloth if need be, if you get anything on it. And it just fits right back in the box. My hubby's been putting it on the top of his head to, you know, there's lots of studies we've been reading about how it promotes hair growth. So, hey, can't hurt. That's one thing that we're using it for. Where did I put my lid? Oh, I put the lid on the bottom. Oh, here it is. This retails with Lifepro. What do they got this on for? $92.99 is what they, so it's under $100. We have a group discount code, of course, that gets you 10% off. That code is lymph, but sometimes they do have better deals. So just keep an eye if it's something you're looking at. Sometimes they have flash sales. And I believe these products in the US are all available as well on Amazon. For those of you in Canada and the UK that are looking at me right now going, is this just in the US? I apologize. Yes, it is. I will be completely honest. There is some regulations in certain countries that aren't so conducive to things that are not via prescription. So there are some issues that manufacturers struggle with when you're bringing in treatments that are really, there's no risk to a lot of these products, but the government sometimes has to get their 2 cents. And I know 10 years ago, I had lots of challenges getting these products into Canada because of the licensing associated with laser and LED being very different. So unfortunately, the technology has evolved immensely, but the legislation that regulates a lot of these things has not. So they're widely available in the US. There's quite a few available in Canada and the UK on Amazon, but as far as the Lifepro products, you're going to have to wait a little bit, and I'll get back to you on when some of those are available. The next one I want to move to is a different product. It is what's referred to as a torch or a pen light. And it's got different applications than the mask. So again, the mask, the appeal is going to be, you know, more the anti-aging if you are dealing with inflammation, you know, concerns in the face. This is more of a spot treatment. So this is called the LumaCure. Okay, the LumaCure, they call it a light therapy pen or torch, pardon me. I have an older version of this I got from a medical company. They refer to it as a pen, so that's why I'm screwing them up. The cost of my previous pen was about $1,800. Again, medical costs. You guys know that better than anyone. In this kit comes a few things. So because we are dealing with what probably will be you know, they don't offer it now, but I can see many of these products having a pulsing option down the road. That's what I kind of see in the industry. But as it stands right now, the pen itself has 2 settings, the torch, and it comes with glasses. So this product, I do recommend protective eyewear. Don't I look cool? And what we're going to do with this one, this is going to be more of a targeted or a localized area treatment. Now, if you're dealing with arthritic pain, you've got lumps and bumps that you're trying to specifically target. Okay, it looks like a flashlight. And depending on how close you place this to your skin is going to determine the intensity, but it's also, you know, if you want to treat a wider area, you would just pull it out a little bit bigger. So you won't need sunglasses, but I'm going to put mine on. So you push a button Okay. This has a preset timer of 5 minutes. There is more heat associated with this product than there are the other products that I'm talking about. Just the nature of how this works. And that's also the reason for the much shorter treatment time. So you can see I'm just holding it on my skin. But if I want to treat a little bit of a bigger area, you just pull it out a little bit. You see how the light is cast on a bigger area? You just hold it there. It's really, really hard to do this. I do have a very, very bad knee. As you know, that's how many of you know I got into this. I've got spandex pants on right now, but what I've been doing at night with this is I've been holding it in my trouble, like where my pain is. This outer tendon just kills me. So I hold it there for my 5 minutes. Then I go around the front. I've been doing this for about 5 minutes. And then I've been going around to the opposite side. My pain tends to stem in this area here. So it's an easy thing for me to do while I'm sitting on the couch. What I really like about this, it's not uncommon to see me out and about delivering machines or going to clients' homes for sessions. And this is something you can throw in your purse. And if you're not home during the day and you don't have access to your Vibe machine or your other go-tos, this is a really nice thing, especially if you've got specific joint or small areas where the pain is intense that you can treat on the go. If you're going to do more than one treatment, meaning you're going to use it for more than 5 minutes, just let this thing cool down for equal time. So use it for 5, give it a break for 5 before you use it again, because it does get fairly warm. It has a lot of weight to it. This is steel or cast aluminum, and it just unscrews. Inside there is a lithium battery. And what I will the coolest thing about this is they send you, this one's pretty easy. Oh, I zipped it back up. Hang on. So you got your little travel case. There is a wall charger that comes with it. Okay, just open this up. Okay, and they send you an extra battery. Okay, so if you're going on a road trip, maybe you're driving, I don't know, 6 hours to California to see Dr. Schwartz or something, and you need something to get you on the road, you could charge this up. There's a battery in this one already, and there is a backup. So you can just pre-charge those, and then, you know, you've got lots of life to treat yourself while you're on the road. This is just the packaging it came with. I keep it in the dust cover just so it doesn't get dirty. There is also, there's a little sleeve. So if you wanted to not take the big case with you and just take the pen, there's like a little holder that you can take with you. And everything fits back nicely in this area here. So, you know, maybe it's your neck, maybe you've got a spot on your shoulder, maybe, you know, this is a really nice, affordable tool in comparison to some of the medical grades that you can use on the go. Again, any one thing is never going to work for everything, but if, you know, if the guns have been too intense, or, you know, the pain is just too much to stand and you can't even touch yourself, I think you'll love some of the benefits that something like this can offer, because it can very much be hands off, but it's also going to be good as a maintenance piece as you start improving. Just because you feel better, don't stop the treatments. You know, sometimes we're our own worst enemy. You know, we've lost the 20 pounds, so do we stop eating properly? We know we're going to pay the price. So if you are getting some relief off of this, like anything I talk about, regular, consistent use is going to be the best approach in the long run. So on the LumaCare, there's 2 red light settings. One is 630 and one is 660. This has infrared as well. The infrared is at 850. Infrared is not in the VisiCure mask. That's a different light spectrum, and I'll talk about that in a sec. The majority of your LED treatments are going to be superficial on the skin. So they're penetrating millimeters on the skin surface. Infrared, the light that you don't see, penetrates much deeper, up to 3 inches. So if you are trying to treat lymphomas, you've got muscle tension, you know, deep in the muscle tissue, something like this that brings infrared as well into the equation is going to penetrate the skin deeper. So that's just one of the specs when you're looking at these things to pay attention to. Sometimes they call it FIR, sometimes they call it far infrared light. That's just the abbreviation. Okay. And again, targeted use, this is going to penetrate deeper because it encompasses both red and infrared light. The difference between the 630 and the 660 is, you know, you're going to notice a difference in the heat. So if you're not good with heat, start with the 660 and play with the higher setting later on, but you're always getting the infrared. The auto timer is 5 minutes. Once it's charged per battery, you've got about 3 hours of use. So this thing lasts forever if you're only using it 5 minutes at a time. And like I say, if you're treating multiple areas, make sure that you give the torch about 5 minutes between treatments just to cool down a little bit. Charging time will take up to about 5 hours. The lithium batteries are pretty substantial in size, so they're going to take a little bit longer. But as I said, once you're charged up, you've got 3 hours use time. And it does include the 2 batteries, the carry case, and I forgot there's a little wrist strap in here. Maybe you're going for a walk or something and you don't have any pockets. That was also, I just didn't have it in the kit. So the very last product I'm going to cover today, and I'm probably, the price. Lula Career Torch is $119.99. Again, 10% off if you use our group code, but keep an eye. They do have sales from time to time. Amazon has sales from time to time if you're in the US. And I'm just going to make sure, do we have any, does anyone have any questions, or are we okay so far? Where's my convo chat? Hello from Campbell River, Kim. Hello, Beth. Happy Saturday to you. And hello, Cynthia. Okay. Just wanted to make sure I had the chat going. So the Aliva Red Belt, this is the big one most people are going to be talking about. And it probably mirrors the most the old technology that I used to use. The old technology I used to use was there was like a big power unit, and there was all these paddles that came off of it. I felt like I was in a Spider-Man's, I was Mr. Octopusy or something. The Aliva Red Belt is marketed, and many of these are marketed as that fat treatment. This is going to make you skinny. It's going to, help you lose weight. And I'm going to break that dream apart a little bit today. Yes, you can absolutely reduce inches. You can absolutely improve skin tone, but weight loss is not going to be melted off your body. I don't care what they're telling you. And all the more reason, if you're just joining me now, I stressed earlier on in the session, anytime you're using red light or any other non-invasive type of treatment to accelerate weight loss, there needs to be a post-exercise component. I know the exercise word sucks. It's not everybody's favorite, but whether you're doing, Patty might do her bike or some kettlebells. I want you to get moving if you're using these products as a post-treatment for fat loss or inch reduction. But the belt is also very nice as a soothing pain treatment. So let's get into the belt here a little bit. Of course, it comes with a manual. And some of the specs I want to talk about here quickly. There's quite a few more settings. Hang on. I'm tripping on crap all over outside of camera here. I'll put these back up here. There. Okay. So first of all, the belt itself looks like this. This is all folded up fancy. So there's a big Velcro piece. You've seen, I'm sure, several similar versions. It has 105 lights, okay? And, this is probably going to be marketed more as a waist belt. And the reason, because that's where most of us are targeting. But you could also use it on your hips, your thighs, your shoulders, your bat wings, whatever you want to treat from an aesthetics standpoint. So if you want to use it for skin tone, maybe you've had some surgery, if you're looking at using red light, this is going to be, in my opinion, the best bang for your buck as far as a body treatment. The red light there's lots of research about how it expedites superficial wound healing, which is kind of where it sort of started from in the medical world. But anything from veins or rosacea, wrinkles, that we know the benefits of that. But there's also with the heat that's incorporated. I got to get this on because I can't hold the box and put it on at the same time. I just want to put this on to sort of show you. So it goes around here, and I know it's not going to fit everybody, but this is a compression. If it doesn't fit around you or it's uncomfortable, you can just hold it against your skin too. This doesn't mean it has to be a snug fit. You could do the hips. I have been doing my knee. This is another way that you can use these types of devices. So I've been using it to treat my knee while I'm sitting at my desk. You are only limited by your imagination on this one, okay? But for the basic treatment, I want to show you how this works. And there's 2 ways that you can power the belt. It comes with a power cord. One end attaches. There's a little thing on the back of the device here. So you put that in, okay? Now you can plug this into a USB wall plug, or if you've got a little power bank, I charged a bunch of these up. You can use it remotely. So I just want to show you how this looks. Where is my, oh, on the controller, just hit the power button. 2, 1, whoa. Okay, and you can see on the controller right now, there's different levels. So level 1 is the lower red light setting. And you'll notice that not all the lights are on, the 3 middle strips. If I go to 850, next one, infrared is now incorporated. If I hit level 2, the intensity comes up on this, okay? And you can see I'm up to level 4. So this is changing the strength of the lights, okay? Now, I want you to see here closer up. It's not going to hurt your eyes, but you can see these ones are illuminated. These are your infrared here in the middle. Okay, so you're not going to see them on. Don't expect them to. Okay. And one thing I will say, after about the 5-6 minute mark, this gets warm, but not to the point where it's intolerable. Now, I do recognize many of you have sensitivity to heat. So it's one of those things, you know, if you're overheating and it's getting too hot, you may need to take a break. If you're just using it specifically for pain management, you could wear it over clothing. You know, it emits enough heat. But if you're using it to reduce fat, if you are using it to treat skin, you want to have it directly on the skin surface. So if you sweat a lot, you know, this whole thing comes out and you can clean. Like this zips out the lights. Hang on. There's a zipper where you can actually take the lights out and throw this thing through the washing machine. Another way, if you don't want to throw this through the washing machine, is just take a piece like saran wrap or shrink wrap and put it around the area that you're going to treat and put the belt over it, so that if you are sweating profusely, it's kind of staying within you, or the rolling down your butt onto your towel, and it just keeps it off the belt. But that's a way I used to do it back in the shop, is I would lay saran wrap under the lights. But yeah, it's warm at this point. I was using it a little bit earlier. This one, I have a really bad shoulder, and I've been playing with just wrapping it. Oh, hang on, I'm backwards. There. But you could wrap it just around the shoulder if you find that's more comfortable. I know a lot of you are dealing with neck tension. You know, many of you are seated at a desk all day long. So something like this could be manipulated and worked into your workday if you really, really wanted. A lot of my guys like just putting it around the low back. And you know, you could even, if you're using a battery pack or you've got a USB charge in the vehicle, you could even use it on the road. So really, really clever in the design and in how they've incorporated how this is going to work for you. And there's 4 different levels of intensity. Like I said, it's got the infrared, and depending on where you want to wear it. You know, many of us can't afford the commercial grade. This is the priciest of their 3 products, but it still comes in, it's $205.99. So it's less expensive than most of their vibration plates. So again, 10% off with our group code. But they do have sales from time to time on their site directly. If there is a sale with Lifepro in the States, or I see it on Amazon or the UK, I usually try to throw it on so you guys are aware of it. But just keep an eye. This product is also available on Amazon. I will say right now, they are out of stock on this product as of a couple of days ago. It's been hugely, hugely popular. They launched it about a month ago, some of the red light stuff. And they're pretty good about having it back in stock. So if you are looking at this one, you'll have to wait a little bit because it's just out of stock at the moment. What else can I tell you? I need to get out of this now. I'm going to turn this off. I just spilled my coffee all over the floor. Awesome. Hang on. Oh, that's just great. Okay. So most of you have, little battery banks. So I just, for this session, charged up a couple to go with this infrared belt. And that's kind of how I've been using it. I got kids, I work at home, and sometimes being attached to a computer, even with my earbuds, is confining. So I really like the portability of all of these products. Many of you are on the move and on the go, and any of them can be incorporated into your lifestyle. But again, there is never one product that's best for every application. They all have their place, and they do have different settings and intensities. A couple of different, just some specs specifically about the belt. Size, it's 49, just about 50 inches in length. And it's just about 7 inches wide. So, if you wanted to treat more than one area, this is where I also get a lot of questions. If you're looking at accelerating weight loss, would you work out 10 times a day? So you can overdo anything. So if you're looking at accelerating weight loss, I don't recommend using this thing for 5-6 hours a day. Pick an area that you want to treat, stick with that area for a period of about 8 to 10 days, and then pick another area. You don't have to do what I say. Many people are using it in different areas, but I think you can overstimulate your system. I think that you can overdo it. And because you guys are just a little bit more sensitive sometimes and react differently, start conservative. So if let's say you're going to do the waist. So you're going to do your 30 minutes a day for 8 to 10 days in a row, then move to the thighs, or then move to the arms. If you wanted to treat a couple of areas a day, and you were going to, maybe you want to use it just for therapeutic on the back, you can use it more than once a day, the device itself, but just like the torch, make sure that you give it a bit of downtime. If you've just used it for 30 minutes and it's warm, give it about 15 minutes just to cool down a little bit. It's going to prolong the life of your investment. Some of the things that I teach you guys doesn't mean it's going to be harmful or bad for you, but you're spending money on these things. So if you're using it 5,000 times today and there's no additional benefit to doing that, why shorten the life of your stuff? So, just like I say on vibration machines, you can certainly stand there for half an hour if you want, but if you're just doing one position, you're only getting limited benefit other than the lymph and the circulation continuing to move. So, part of the reason I try to coach lots of intensity and short durations with my things is to prolong the life of, what you've just put on your credit card. So same with these products. Don't run this for 2-3 hours and then wonder, why you might be having issues with it. It's meant to run for 30 minutes as an operating time. If you want to use it again for other things, just give it some time between treatments. Also with the Lumicure, make sure that's the case. And the mask doesn't really get warm. And it's also a little bit, I would say it's not cold. You can feel that there is a bit of a warm up, but it doesn't have the infrared spectrum. So the heat is different. And it's a little bit away from your face. So you won't feel fleshy or hot with that one. And, I've used that one, after a couple of minutes, so I'll do my face and then I'll pass it to hubby and he'll do his thing. But with the belt and with the torch, give it some downtime between treatments. What else? This actually, the belt has an auto timer. You can go anywhere from 5 to 30 minutes. The actual temperature that it operates is anywhere from 32 to 113 Fahrenheit, just to give you a number. And we know that red light improves many things I've already talked about, but some of these things are really great, not just for deep tissue or muscle pain, but aches and pains in the joints, that arthritic that you're dealing with, just general stiffness and soreness. I think you'll find this is quite a tolerable and soothing treatment. You just got to gauge whether you can handle, and it's not hot like a sauna, but I know some of you were very sensitive to heat. So I just wanted to bring that up. What else can I tell you? Is it safe? Yes, it's safe. I wouldn't be talking about it if it wasn't safe, but I can certainly throw you a study. There was one particular study, and a lot of these studies are old. This isn't new news. 2011, body contouring and spot fat reduction was explored, and it was found to be safe and showed significant girth loss sustained over repeated treatments and cumulative over 4 weeks of 8 treatments. So, there's a mentality out there, and I hear it a lot from the doctors in this community, that you can't lose weight with lipedema. I don't know, because so many of you seem to be having some pretty damn good results. It's not going to be the belt or the vibration machine that puts you over the edge, but many of you, when you're making choices and you start moving and feeling better due to some of these choices, other good choices come into the equation. We start eating better. We start sticking with our vibe workout more often because we're motivated and we're starting to see the results. So, I can't say from a medical perspective that it's possible, because there's a lot of people that seem to think otherwise. But I just have so many of you that are doing tremendous. We've been here a little over a year now. And, is it the fact that you're sticking with this and doing it more regularly? Is it that you've combined other treatments and you just finally found the right combination? I do not know. For those of you that are frustrated, I'm not the medical person that some of you are dealing with, but I don't want you being discouraged, because I too often have seen people, maybe they're not getting down to a size 2, but I have seen some substantial, amazing results between lymphedema and Derkums, where they are losing weight, they are toning, they are getting some definition. So I just prefer to be hopeful. And I think some of these tools incorporated and used consistently, who knows, but you're certainly going to feel better and move better and be stronger in the long run. So that's my 2 cents. Another study in 2018, something a little bit more recent, demonstrated significant results for treatment of medical conditions, including mild to moderate acne, vulgaris, wound healing, psoriasis, squamous cell carcinoma, which is pre-cell skin cancer, basal cell carcinoma, which is a little bit further down the line, and many cosmetic applications. So they've just lumped that into one. Study in 2014 looked at to investigate the safety and efficacy of 2 light sources. The results were very positive. Researchers concluded that treatments experienced significantly improved skin complexion and skin feeling. So the texture of it was much improved. This blinded clinical evaluation of photographs confirmed significant improvement in the intervention groups, as opposed to those comparisons. So those that used and those that didn't use. So what they do with some of these studies is the devices look the same, but some of them have the proper lights and some of them just have little lights, and you don't really know which one you're getting. So that's what they mean by the intervention group. So the intervention group used a similar looking device, but the lights themselves were not the LEDs that we get the benefits with. And the last one I will get, can boost cellular activation, an important factor for the treatment of cellulite. Not that any of you deal with that at times. Researchers combined LED therapy and treadmill training in 2011, primarily as a treatment for cellulite, noting a reduction in saddlebag and thigh circumference can result from a further improvement of body aesthetics. So I know that there's probably not a whole world of studies out there where they're using these on lipedema and Derkums disease clients, but a lot of the benefits known with lymphedema, the poster child that does get a little bit more attention, are universal treatments for you guys as well. So a lot of the research around lymphedema that is using red lights would lay similar benefit to you guys here. And red light, just like vibration machines, and there's other lights, light in general moves lymph. It boosts circulation. So a lot of the primary reasons that you guys are following me and using your vibe plates in the first place are the basic benefits of these anyway. So if you're not looking to get rid of your wrinkles and you're not looking to skin tone, you're still getting, in a very soothing treatment, a boost of circulation and of that lymphatic movement as well. So for those really, really crap days where you just don't feel like moving, when you move, lymph moves. Here's some alternatives that you can look at just for that piece of the pie. So I'm going to put paste paper away now, and I'm looking here. I've got that, but haven't taken it out of the box because it's not as big as I thought. I don't know which product you're talking about on that one, but please let me know if I can answer further questions. What's the waist size that the belt fits? I said earlier, the belt itself is about 50 inches around. If it will not completely go around you, you don't have to have it fastened to use it. Just, nestle yourself up against it, or, maybe wrap a towel around it to keep it in place. But if you are larger than what the circumference of the belt is going to accommodate, you could even do it maybe in 2 sections. That might be an exception. Use with clothes on. I'm assuming you're talking about the belt. If you're just using it for a pain treatment, a thin layer of clothing isn't going to affect it. You will feel the heat, and it's quite comfortable. If you're looking at it as a skin treatment or to accelerate girth loss, yes, you want to have it in contact with the skin. That's going to be the best way to use it. All right, so I'm going to ask if anyone here, I've got quite a few of you. Tracy, hello, Fran. Fran would be an example. Look at how Fran looks these days. Now, I'm not taking credit for that. There's a lot of things that Fran should be giving herself a pat on the back for. But Fran, Kim, there's a lot of people I've known in quite some time, and I've seen you come down. And, I'm not laying claim that it's the vibration plate. I'm just saying in general, when doctors tell me that you can't lose weight with these conditions, I just see too often the contrary. So I'm just going to leave that in there. Cynthia, do you have a question?
I do. Hi, Debbie.
Hi, how are you?
I'm great, thank you.
Thanks.
So you mentioned that you should do the exercise after using the red light therapy.
If weight loss and toning is the goal, yes.
Okay, so and what's the sort of optimum time frame?
It depends on you. So if you're wanting to just specifically use it as a post-treatment, 2 to 5 minutes of passive standing, maybe some pelvic tilts. If you've got range of motion, you could put certain body parts. I've done some massage. So if maybe you're treating the thighs or the bum and you want to just ramp that area up, you could add a little massage as well. But a couple 3 minutes just to expedite that lymph and the blood circulation and help the process give you a little bit more optimal benefit. If you've got bigger goals or you're doing bigger things on your machine now and you're doing exercises and doing a workout, you could do your regular workout after it. So I don't like to put a time on anything because it is an individual, depending on you physically and where you're at. And so many are dealing with fatigue and just pain. So for me to say, you got to do a 20-minute high intensity class isn't optimal for everybody, so if you're baseline and just starting out with this and want to measure sort of whether it's offering any benefit or not, 2 to 5 minutes, bare minimum stuff, whatever feels good to you, Cynthia.
Okay, and should it be immediately after you've done the red light therapy, or if you have to shower
thereafter? Yeah, I used to remember before everybody got into the vibration machines, there was a clinic I went to and they were just incorporating the machines, and she was very diligent because in the old days in the commercial menus, there was a whole page that they'd outline, this is important, and they'd give you some suggestions. And she didn't want treadmills and she didn't have the space, but she was getting the machines, but had been doing the treatment already for about a month before I came into her life. And it was so funny when I was there, I kept remember these women would come out of a room and then they'd go out the door and they'd be back about 2-3 minutes later. And I said, well, where are they going? And she goes, oh, I make them walk around the block twice after they do their treatments. I thought that was so cute, just to get them moving, right? So, if you don't have a vibration plate or you don't have a Peloton bike or something that you're doing exercise with, do a couple squats, walk up and down the stairs a few times, just do something other than just go sit on the couch, if that makes sense.
Yeah, and can you do them simultaneously if you like have the belt on and you're on the vibration?
Good question. I don't see any harm. I use the belt and the mask at the same time. The light itself, I'll be honest with you, it's been out on loan more than I've actually had time to use it myself. I don't see why you couldn't, because they're all different applications to a degree, right? I had a lady the other day that had the belt around her neck and the mask on her face because she's really trying to target the skin tone in this area. Why not? just make sure that you're not tripping on cords. You don't, the biggest thing I forget about when I'm hooked up to the belt and I've got my mask on is I forget I've got the belt on and I get up and I trip on the cords, so that's just my only caution. But yeah, I don't really see any reason why you couldn't.
Okay.
Anything else? Have you got any of these now, Cynthia?
I have them all.
Oh, you have them all? Are they all Lifepro or is there another brand?
I have all the Lifepro ones, and then I just got a platinum panel system as well
Nice.
that I'm starting to use.
My friend has what is it, a Juve? Some of the panels that are coming out, there's beds, that's starting to get more into the realm of commercial, but I see more of the panels kind of being designed for that home use client. And, the reality is many of us have been locked up for a couple of years. So the home treatment market has really kind of taken off. And they don't have one yet, but I've kind of been saying to Lifepro, like, it'd be really cool to have a panel too. So we'll see what happens down the road. But I think as far as affordability, for me, the panels would probably be something I would invest in after I've sold myself on some of the smaller products. They have their own peel and their own application as well. I'm curious to see how you enjoy that. I want to get one too, but I'm going to wait and see if Lifepro comes out with one first.
Yeah, but I love my Lifepro products too, so I still use those.
In all fairness, Cynthia, because I'm an expert of talking for sure, but many of the things I talked about today, do they resonate? Like, they're really not that warm. They're comfortable. Would you say I was online with?
Oh, absolutely, absolutely.
Cool. I did do a review. I do launches with Lifepro once in a while. They invite me to actually do product features. And I did these about a month ago on their page, but I got them literally the day before. So it wasn't the best demo because I didn't know how to work this. And I didn't know, they all came pre-charged. So I was freaking out thinking, oh my God, anyways. But yeah, I've been using certainly the belt. I wouldn't say daily. I've got to get better at that myself on my knee and my back. I just love it. The mask I do every night. I have horrible skin. I have lots of scarring. I used to be a really bad picker, and I put makeup on, and until you're later in life, you don't really pay attention to those things when the wrinkles start. So I'm starting to notice certainly a texture change. And I would, if I had to describe it, I would say that the reoccurrence of breakout is dissipating. I'm probably on about day 8 of being consistent. I started and I had the best of intentions, and then I stopped because life got in the way. So I'm just like you guys, at the end of the day, life sometimes gets in the way. But what I do love about Lifepro and a lot of their products, a lot of the stuff that they come out with is based on consumer feedback from you guys. Well, I like this, but I would like it to do that. And, same with the vibration machines, the multi-movements, the different features, a lot of that comes from feedback from you guys that want different things. So like I said, I've been nagging them for a panel. We'll see what the future holds. Did you have any other questions, Cynthia?
Well, also on the simultaneous question is, can you work out on the vibration plate while you have like the belt on?
You know what? Actually, I don't see why you couldn't. Depending on where you're treating, if your thighs are shaped more like this, and you're wrapping it around an individual thigh, it might slide down, but around the belly, around the hips, around the shoulder, if you're doing things on your machine that aren't gonna, send it, if you're not doing a bunch of big wide squats with kettlebells and stuff, you'd probably be fine. But it's funny you bring that up. That'd probably be a good way if you are short on time to skip, the 2 to 3 minute workout to do it. Yeah, do it while you're doing your workout. I think that's absolutely fine. Good question. What vibration plate are you using?
I have the Waver.
Nice. Okay. So yeah, oscillating movement. I have a preference. There's lots of different movement styles out there, but oscillating mimics how we walk. I'm all about functional training, making you more functional. And there's other types of movement, but we don't hop around like buddies, and we don't, they're an extra. And, it's really a touch and feel thing when it comes to the wellness and in what you like. But for your exercises, to get that lymph moving, I feel oscillating offers the most movement, the most amplitude, and it's less invasive on the head and other things. It's more natural feeling to the body. So that's my preference. But you can do your workout in any mode that your machine may have. I just prefer oscillating. It's going to give you the most benefits in the long run. Does anyone else have questions here? Oh, I have another question back. Oh yes, you can lose obesity weight, and we have all. Oh, so Kim's backing me up as well on the weight loss thing. It says, I don't have your name, but it says, I'm struggling with back and sciatic issues and haven't done vibration plate because I'm afraid it will to hurt myself more. I'm glad you asked. I am a big sciatic person. I deal with it very commonly because I never did get the knee fixed. If you look under my media files on this page, there are about 15 workouts for feel good stuff, and there's about another 15 for fitness stuff. And there are a couple of sessions I've done specific to back and spine. So the big thing, it's common to be afraid. And, you know, I'd rather you be afraid and ask questions than get on it and spook yourself. But the big thing when you're dealing with pain, especially in the back, is on your plate, bring your feet close to the center to reduce the amount that you're moving. So the wider you stand, the more you're moving, the closer to the center, the less you're moving. And there's a couple of ways you can stand and position your body to target those areas. But if you go into the media files and look under Feel Good Fridays, you'll see a number of sessions there. And if you'd rather, it's a little bit hard while I'm in the middle of the session here. If you want to drop me a personal note or or if you can just be a little bit patient later on, once I get this downloaded and up recorded, I'll drop the session specifically I've got in mind in this feed, but I probably won't get the recorded version of this up until later this afternoon. It usually takes about a couple of hours to download it and re-upload. So yes, and you know, it's low impact. So for a lot of people with back issues, this is vibration is kinder on your body than even walking in some instances, but it's understanding not so much a setting, but how to position your body to target those areas and give you the relief that you're looking for. Those same positions in the long run will also begin to build strength. They're going to move your lymph and your circulation. You don't have to do specific things. The positions that you'll use to treat the back are going to give you those general benefits as well. It's just the nature of the technology. Does anyone else have questions? If you do, please take yourself off of mute and ask me a question. Oh, I see Patty has also asked me a question. Hi, Patty. I sit on mine for sciatic relief at the lowest setting. Yeah, if you've got the range of motion like Patty, getting down on the ground and sitting on the machine directly is a great way to target that muscle. Patty, I would suggest if you've been using the low settings, I'm not sure what machine you're using for. I'd still love to have a chat with you just so I understand a little better what you're using. But I would recommend bringing up to a mid or even a higher setting. And when you're sitting on it, if it gets too invasive on the head, just lean forward slightly. It's not harmful. It just takes some getting used to. But there's a little stretch that I do while I'm sitting. I'm going to bring this down so you can see. So while you're seated on your machine, take this leg and cross it up. So you want your ankle here, if you're able to do this. This is a common stretch that a lot of your chiropractors are going to show you. And this is primarily stretching the glute. But visualize you're sitting on the machine doing this. Take your hand on this knee and apply a little bit of pressure, and you're going to feel it open up that hip. You'll feel a little bit more in the sciatic. This is a really good way. I do this 3-4 times a day sitting in the chair. It's not uncommon to see me sitting on my vehicle, pulling my leg up on the steering wheel just to get that area stretched. So that's a great thing to bring up. There's also another one I like to do called the nerve floss. And I'll leave the view like this, but while you're seated on a stool, if you're unable to get down on the ground like Patty, sit yourself in your stool, your feet are on the machine, and you're going to extend one leg out in front of you and just lift and straighten this leg. While you're doing this, lift your head and look back like this. So you're looking up and then you relax the leg. It's called a nerve floss. Google that one. You'll see a few different PTs and physios doing that one. But for those of you that are, Patty's obviously got game and she's a lot more mobile and fit than some of you. She's got the strength. I really I support a lot of you from her page, and I'm glad that you have her as a resource. But for those of you that are unable, like Patty, to get down and sit on the plate, there are some seated on your chair options as well. Patty, I'm curious, how often are you doing something like that? Is it just when you have an issue, or is it something you're doing regularly with your seated on the machine? Every morning. Awesome. So, whether you're having the symptoms or not, that's the perfect example. Do the maintenance too. You don't want to get yourself in, don't let things digress to the point where, you're debilitating yourself again, where we're on our own worst enemy. Then I stand for lymph, part of your self-care. That's great. That's great. So she's doing a variation of sitting and standing, and yeah, even just standing there is going to give you some basic lymph. And I know that Patty has a lot of passions for other fitness modalities, and any of those fitness modalities, if you're working through Patty's page and following some of her guidance, is exactly what I'm talking about. It's not necessarily all about your vibration machine, but it's a great tool if you have one, to use for a couple, 3 minutes before and after, not just red light treatments, but if you're doing any athletic type stuff, you're doing bikes, you're going to the gym, you're going swimming, just to help facilitate and ramp up the results of everything in harmony. It is great before and after on Peloton bikes. And, if you've done a Peloton session and the cardio is through the roof, maybe you still want to do some strength training, and maybe your after session is a couple of squats or a couple of push-ups. There's lots of ways you can incorporate, and boost the workout that you're doing, and target areas that maybe you haven't focused on so much in that exercise. It's really hard to do a whole body workout. I talk about this more on some of my other fitness groups, but nobody goes to the gym and does everything. You'd be there for 3 to 4 hours. A lot of my guys are like, oh, it's leg day, or it's core day, or it's arm day. So I tend to break my vibration plate workouts into smaller, more targeted body parts. But for things like lymph, circulation, balance, pain management, just standing on the machine and incorporating your natural body weight is going to kind of give you that head to toe relief. Bottom of my squat is always a go-to for me. I feel the best in that spot. Stretch is so good too. So I think you're referring to going deep in your squats. Patty's got a little bit more game. As I said, there's nothing wrong with those squats and incorporating some weights. I happened to get some new toys also last week from Lifepro. Oh yeah, I have an 85-pound, and I also have, I don't have it there now, the smaller click weights. And a really good way, if you are dealing with fatigue or pain and you can't handle long durations in your exercise, while you're doing your lunges or your squats or your standing positions on the machine, incorporating body weight, adding more to your mass, is going to make you fatigue faster, and it's going to make those muscles work harder. So there's, if you have things around the house already, feel free to incorporate those at your leisure. Stretches so far. It does offer a good stretch. Being seated on the machine also is a good way to stretch if you're unable to do things like toe touches, or the balance isn't there and you wouldn't want to do it on the machine, or perhaps you're dealing with poor mobility. I have a number of pediatric clients I also work with that have no mobility, because there's a lot of paralysis that I'm dealing with, and many of my kids with CP have really, really tight hamstrings, to the point, if you know someone with cerebral palsy, it's really common that you don't see the heels hitting the ground while they're walking due to that tension. And instead of 20 minutes to a half hour of manual massage or rolling on the back of those hamstrings, for my poor parents, 2 to 3 minutes seated on the machine, evolving it into a little bit of an assisted stretch, is really all they need. So one of the big things I love about these machines and devices, just alternative technologies that are not invasive, is if they're easy and they don't take a lot of time, you're more than likely to stick with them. So, any way you can incorporate these into your self-care, the sooner you start moving and feeling better, the more you can progress to other goals and other challenges if you choose. Who else might have questions for Debbie, or feedback or comments? Does anyone else have anything they'd like to say today? I have Rebecca, I have Angela, I have Tracy, I have Fran. I have Sarah, I have Patty. You may not have any questions, and that's okay, because your head is probably spinning from all the dialogue that's come out of my mouth. So I want to thank all of you for coming today. Lifepro is one of the many companies that I represent when it comes to vibration machines, and I do a substantial amount of training for them. But I love them for lots of different reasons. They sell other things because as I love incorporating other things with plates, other things that you have at home. But the biggest reason I recommend Lifepro, for those of you that have not joined me in the past, they have a lifetime warranty. And as the trainer back in the day, the last thing I didn't want to deal with, and there's a couple of you on this call that have known me in a former life, and the last thing I want to do is be on a call fixing you and your machine breaks, or I have to deal with it when it breaks. So, you know, things happen. Technologies have issues. Sometimes there's manufacturer issues, but I've never had to deal with a problem when it comes to that. So I would rather spend my time helping you, teaching you how to use them, and not troubleshooting, whether it's the circuit board or, you know, the LED screen or what have you. I certainly can service a vibration machine and have probably taken more apart and put them back together in my day than most manufacturers. But, you know, if these are your essential tools and they are taking away your pain, the last thing I want is you guys being out of commission for a week or two because, you know, you're waiting on a part. So Lifepro has been very generous in supporting me, in sending me these type of products so I can put my 2 cents through them and give them. Usually my feedback is tremendously good, but you know, they're also very receptive when I have issues. You know, I don't like this, or this doesn't make sense to me. They're very reactive to my feedback, and I appreciate that too. So wherever you are in the world, vibration plates for Lifepro can be obtained in the US, Canada, overseas. But as some of these new technologies come out, primarily you will see them launch in the US. They are a US based company, so that's where the majority of their product is going to be sold and distributed. But you will see after a period of time, it's not on the guns. You know, they weren't available in Canada. Now they are. Some of the hand massagers. So there's lots of choices out there. And if you can't get any of these devices and they are available for sale in your country under a different brand that you're looking at, just remember a few things I said earlier on the call. Is there a company attached to this? Is there somebody you can pick up the phone if you have questions? Is it just a product that Amazon is selling under another label and there is no real company? If you can't find any specs or settings, like if they're not specifically telling you what the light ranges or the wavelengths are, if there's not a manual, so there's a few clues, you know, that you might want to take a look at. And it, you know, just because it's a good deal, think about your relationship with this product that you're going to be using, how often you're going to be using it. And, you know, if you're saving 20, 30 bucks and the thing breaks and you've got to buy a new one in 6 months, kind of defeats the point of that 20 bucks you saved. So, you know, I have a lot of different vibration machine companies that send me machines, but not everyone makes a good impression. And I'm just going to leave it at that. What else can I tell you? I will be doing more sessions on other good things. Yes, I am the vibration machine lady, but there's a lot of things that I've been combining and distributing as well for years and years. And you know, there's a lot of medical devices out there that you guys spend money on. And I honestly do not believe in every situation, the medically, you know, approved or the $10,000 version always offers more benefit. You know, I'm really not certain of that. Some of the commercial products offer longer warranties. They've got more infrastructure and support for the clinics, but is the device itself different than what you might expect from the benefits using at home? I don't know. I'm speaking from personal experience. I have a $20,000 light device, and I don't really see more improvement using that over my $200 belt now. So that's just my 2 cents. And, you know, if you are looking at investing in this technology and it works for you, I'd sooner you spend $200 to $300 on something that you can use more regularly than physically having to get in the car and go to a clinic, you know. So sometimes going and trying some of these devices in a clinic costs you more in one treatment or two than to buy one at home. So if you've got any other brands out there you want me to take a quick look at, because you can't find what I'm showing here today, and you are looking at other Asian brands that are being sold through eBay or Amazon in different countries, let me know and I'll certainly have a quick look at it. But the big clues are looking for specs. If there's not a company that you can contact or you can't find that company existing outside of eBay or Amazon, keep shopping and just make sure that you are actually dealing with a company and you're not just bringing in the Cynthia light because she just decided to bring in a container and make a buck this month. There's a lot of people selling devices at trade shows where they're just bringing it in to make that short-term buck, and there's really not a company there after the fact. I hope that makes sense. Cynthia, you unmuted. How did you have a question?
No more questions. I was amused by your example.
That's just an example. I could have my own vibration machine. I could call it the Debbie Vibe, but I don't really want to deal with the importing and the exporting and people breaking things. And there's probably a lot more money to be made, but I prefer being the consult that helps you use all of these. So of course, I'm always available for consultations. That is how I feed my children. I do get commission when I recommend products from time to time. I'm not selling $10,000 light devices, so the commissions are nominal, but I want to be completely transparent on this page. I think I get about 5%. So just to give you an idea, if you do purchase something through my link, I do get compensated for that. But primarily my 9 to 5 is supporting you. So if anyone is looking for a consultation, I charge $40 for a 1-hour call with me. We do it on Facebook or Zoom or whatever. And if you are struggling, specifically if you're dealing with medical concerns, post-surgery use, some of those things that aren't really a general conversation and you want to employ me as a consultant, I can give you details if that's something that you're looking at down the road. And that also goes for clinics. My clinic rate is not $40 an hour, but if you did want to look at incorporating some vibration plates or you wanted me to develop some specific protocols, I do that, and I assess it depending on your needs. Sometimes it's a half-hour phone call and we don't even need to get to a booking. But if you're looking at running a class or incorporating this into an osteopath office with specific purposes, I do offer business consultations and clinical meetings as well. Okay, I'm going to shut up now and I'm going to give you all one last chance to blast me. Sometimes things come up after we've spoke because your head is spinning from my talking. So if you do have any other questions, drop it in the event today or wait till I get the post up with the recording and I'd be happy to answer those for you. If you had anything super specific and don't hesitate to reach out to Lifepro directly. It is their product. They do have help on the weekends on the chat line, and I think you can get them during the week on the phone most days. But if you did have any questions specifically for them, or you're an existing Lifepro client, take a look and see what they, any questions that they can provide. All the manuals are also on their page. So if you want to look a little bit more specifically under each of the product listings, you can look at the manual. There's other information to be seen there as well. Thank you, Kim. What a great session. Oh, thank you for listening to me ramble. To anyone needing personal help, Debbie has reached out. I did do some coaching with Kim early on, and she's been generous ever since. She's kind of my Durkheim's disease guinea pig. So anytime I have, how does this work with Durkheim's disease? Can you try this? So Kim's been very supportive, initially reaching out to me as a client for support with a vibration machine, but she's now got 2 vibration machines. She's got a gun. She's got some compressions. Yes, I also talk about compressions. I'm going to rip that Band-Aid off right now. I will be featuring a session probably in the next week or 2 on compression garments. I'm not talking the tights that you wear. I'm talking about compression devices, things that expand and contract and pump your body. Many of you are using these types of devices now. Many of them are medical grade. The reason I'm going to be talking about them very shortly is just like vibration machines. Most of you cannot afford, or your insurance company is not going to entertain giving you the funds that you need to get the proper medical compression garments. So there's alternatives, and Lifepro sells a few of those, and Cynthia's probably going, yeah, I know about those. Kim's going, I know about those. I got to be honest, out of respect for the research community and some of the vendors in this community, I haven't introduced many of the things that I work with. But a year into this, I still have a lot of people that need help. And it's not like any of you have won the lottery. So I'm going to start introducing some of these more affordable alternatives. I believe they are absolutely effective. And if your insurance company or your doctor isn't willing to give you the time of day to give you the prescription you need to get the devices that you should be using, there are alternatives out there that are probably less than your deductible in many cases on some of the other things. So we are going to be doing a compression session. I'm going to be talking about a couple of different heated compression, and I also have a cold compression device, not wearables, that I'm going to be talking about here. Probably not next weekend, but I might do that one during the week. But I had a really good turnout today, so maybe Saturdays are a better day. I used to do my stuff on Wednesdays, but I do know once a month we run into our friends at the round table. So Wednesdays aren't always a good night for you guys, because many of you and myself sometimes attend the round table as well. So yes, I am going there with compressions, how to incorporate them with your vibration plates, why you would use them. And many of you are familiar with these types of devices. It's just been, out of reach financially. And, because I know about other things and because I have access to other things, I feel I have an obligation to share such things with you guys. So I'm going to be doing that here in the next couple of weeks. And I'll post that up as an event, as I have done for today. So yes, I love my, if anyone's ever seen Kim's legs in her sessions, I also have legs, I also have booties. And Lifepro has been very supportive again in, letting me experiment and do, I have to do my due diligence because I'm putting my name on these things. I'm not just recommending things that showed up in the mail and I think I can make a good commission on. If I'm putting my name on something, it's something I've experimented on myself and many of my clients, and pretty often my kids, because I want to know for myself if something goes wrong, because sometimes things do go wrong. It's not a bad thing, but I just want to know how to manage and switch gears, So if you've overdone something, I want to make sure that I can offer you relief and help you navigate until things subside. So thank you very much for joining me. Have a fantabulous weekend. If you have your light devices, use them regularly. If you don't, I hope that I have given you some affordable alternatives that improve your self-care. And if you're using these types of products as well, feel free to share how you're incorporating them with your vibration plate, and what kind of benefits you guys are seeing. Thank you so much, you guys, for joining me today. It's always a pleasure. Thanks so much.